So when we look at health and nutritional concerns, it's important to note that in the United States, food insecurity is also associated with high disease rates, things like heart disease, diabetes, high blood pressure, food allergies, and obesity and overweight. Um, Professor Coots mentioned before that obesity and overweight are nutritional concerns of food insecurity, which seems to be a paradox because you would think someone who's overweight is actually getting too much food, but really they're getting too many calories, but they're the wrong kind of calories. People are over-consuming fat. When you look at the low-income families, they're purchasing low-cost items that are energy-dense, but they're not necessarily nutritious. So they're gaining weight and becoming obese, but they're actually at the same time being malnourished. Again, a lot of this is caused by food deserts, so people going to convenience stores and purchasing, bags of potato chips that are very cheap, but very fat intensive, very high carbohydrates, which then leads to these nutritional problems. You also have boom and bust cycles linked to the distribution of food. So for example, things like food stamps, you can only get so many stamps per month. Generally, a food bank, you can only access it 4 times per year. So if you think about how often you go to the grocery store and you think about a person that can only actually access something like a grocery store 4 times per year, they're going to have needs obviously in between those 4 times. And so trying to figure out how to utilize all of the social safety nets can be quite a complicated process, and a lot of people exist in this boom and bust cycle. So they might get 100 pounds of food one week, but then not be able to get food again for another 2 or 3 months. When we look at health and nutritional concerns, again, nutrition is highly lack of nutrition is children are one of the most vulnerable populations. So when we look at inadequate nutrition in childhood, this leads to a lack of access and resources in things like education, healthcare, weight management programs, recreational facilities. Children that are poor and in these vulnerable conditions don't have as good of access to those things as children who are food secure and do have resources. So not only are they disadvantaged in the living situation or the income situation that they're in, but they're also disadvantaged in all of the social resources and development resources that they have available to them. And one can see that this can lead to an intergenerational cycle of poverty and hunger. So if you as a child grow up in a poor situation, you have less access to good education, less access to good health care, the chances of you succeeding and digging yourself out of that situation when the cards are so stacked against you is very, very difficult.